Hey everyone, what's up? Dr. Charlie Johnson, physical therapist. Hope you are doing well. In this video, I want to challenge this idea of pelvic asymmetries, leg length discrepancies, differences between how well your right hip moves and your left hip moves. Is it possible that all that is completely made up, is completely baloney, is completely fabricated and not based off of sound reasoning and or evidence? I'm going to tell you it is, but in this video I share with you why, and I share with you a simple analogy to help you understand why a lot of what people have been told is not actually true, and then you can be the judge. So again, this video is perfect for you. If you're seeing someone, chiropractor, PT, massage therapist, somebody else, osteopath, and they're treating you for some type of asymmetry within your pelvis, they're telling you your pelvis is rotated, is twisted, you have an out flare, an in flare, an up slip, a this, a that. They're giving you orthotics to try to, make your legs the right height. They're trying to make one side move just like the other side, all right? And maybe it's working, maybe it's not. If it's working, great, but there's still value in watching the video. And if it's not working, consider that this video may free you from the shackles of that narrative that something wrong, that something needs to be corrected, when at the end of the day, maybe nothing needs to be fixed. All right, so check this video out. Here are my thoughts on asymmetries within the body. Are they something that we need to fix or not? Is it possible we've just medicalized these asymmetries because we really don't know what the heck is going on and what to do about it? Oh, and real quick before we dive into this video, if you are interested in determining the most likely source of your symptoms without having to see all these different specialists and getting all these reasons why that nobody can agree upon and explanations for why you hurt that you're not sure if you can trust, go ahead and check out my DIY diagnostic guide. It lays out my entire diagnostic algorithm to help you move past your diagnosis and move on to what really matters, which is solutions. Solutions for you so that you can learn how to begin fixing yourself. Check it out. Eyebrows are like sisters, not twins. And what this has to do for you if you're stuck in pain, especially some type of back, butt, or sciatic pain, which is all I help people with, right? So, interesting story. Yesterday, my daughter was squatting in the hallway, right? And so she was doing one of these things, right? So here I am, right? Just squatting. And I was showing her how, and my wife, I could just sit like this all day, no problem, right? But Cameron, my daughter, had trouble doing that. And my wife, well, she has to be really tilted forward. She can't be back. And why is it? Because she doesn't have the motion in her ankle joint. So see how much motion I have there. Some people, that's all the motion they have in their ankle joint. And because of that, right, they can't shift their body weight to get into like a deep squat. And I'll get to the eyebrows. I know you're curious about the eyebrows comment here in a second. But basically, my daughter, who's 5 years old, had trouble getting into that same position. And I said, you have ankles like mommy. And then, of course, mommy, Heather, my wife, tried to do it. And she knows, wow, my ankles are stiff, and I can't do that. And so it made me think, isn't that interesting? That my daughter has limitations in her ankle motion, and she's only 5. And so is it that we're trying to fix these stiffnesses, these asymmetries, these immobilities, right, or inflexibilities, but that they've been present all along, right? And so we would never know though, right? Because nobody actually screens for these things. You don't go to your family physician and they don't assess your ankle motion when you're young. They don't assess your hip motion, right, as you get older, or every year during a physical from the time you're 5 to, however you are now. And so you have no baseline. If you have no baseline, there's going to be a video sort of on this. If you have no baseline, then you have no direction for making a call about what's abnormal. If you have no normal, if you do not have your normal, then you do not know what is abnormal. And so this is why in medicine we start treating all kinds of things that may or may not be the problem. Is it possible that the lack of flexibility in your hips or the tightness in your ankles or the tightness in your back that you're trying to now fix to get out of pain could have been there all along? And so it was just an interesting thing that when my daughter, right, was trying to squat the other day, I noticed that she just had stiff ankles, and she's 5. She can do a split. She's flexible everywhere else, but for some reason her ankles are a little stiffer than usual. She has mommy's ankles. All right, so when she gets older and she starts to have knee pain when she's running, do we try to fix her stiff ankles that have been there her whole life? Probably not. But now, here's the eyebrow comment. All right, so as we're doing all this squatting or whatever, we go over and I drop my daughter off at my mother-in-law's house. And she watches her. She calls her Gibby. She watches her on Mondays. And of course, I'm talking about this, right? I'm talking about how, like, there's lots of people who, as soon as they start to experience pain, we want to medicalize all their asymmetries, right? We want to say, oh, you see how that hip's a little stiffer on the one side, right? You do this, and it's like, oh, it sticks up, right? You do this one, like, oh, it flops all the way down. I got way more motion, for example, on my right side than I do my left side, but I don't hurt. It's been like that for as long as I can remember, right? And so, is that a problem? Do we try to stretch that tightness out? Or do we try to shorten that one up that has more motion, right? And so when we're in pain, we try to look for all these reasons as to why we hurt. And a lot of times we just medicalize normal findings or things that have been there for years. And this is why it becomes a rabbit hole. And the diagnostic assessment becomes very difficult. Now, eyebrows. Let's talk about that. Okay, this is actually a really good way to put it. All right. So I was in my mother-in-law's house yesterday morning, showing her about how I can do this, right? And how my ankle, look at all that motion. I got really good ankle motion. You could say good ankle motion, but it's just kind of, for me, it's just normal, right? That's normal for me, right? Compared to some other people, maybe that's more, or maybe that's less. Probably doesn't really matter. But it allows me to sit in that position, and I have no problem. Now my mother-in-law, right, she tries to get down, and she's like this. Her ankles are so stiff, she can't put her heels down and stay balanced. My wife, she can do it, but she has to stay really leaned forward. My daughter can do it, but she has to stay leaned forward. My father-in-law, his feet start to go out. He has to turn them out because he has no ability to just go straight over his foot, right? And so my mother-in-law, she had a really good analogy. She said, when I was going to, I guess she gets her eyebrows like plucked, or I don't even know what you call it. What do you call it? When someone gets their eyebrows plucked? Hey, like, do you do eyebrow plucking? I don't even know what you call that. Either way, she gets her eyebrows done, we'll call them, all right? And so, she's going for symmetry, right? And the woman who's doing her eyebrows, plucking her eyebrows, right, or trying to make them look symmetrical, right, said to her something very valuable that could be helpful for you and explain a lot of your woes, explain away a lot of your woes and or concerns about, is my body, my pelvis is this way or that way, or, oh, my one leg is longer, or whatever. She said, look, she said, this is my mother-in-law. She said, your eyebrows are like sisters. They are not twins. They are related. They're in the same system, right? And they kind of probably look similar. They're related. They're on the same face. But they are not twins. You cannot make them like identical twins. So my mother-in-law was there, right? And that clicked for her, and maybe it'll click for you. And what that meant for her, as it relates to her eyebrows, is like, hey, I know you want them symmetrical, but like they're not meant to be symmetrical. Like the human body is not like perfectly symmetrical, all right? Like as much as you want them to be like that would be weird. They're not identical twins, okay? They are sisters. They are related, but they're not twins, okay? Now, why does that matter for you? You might say, what the heck does that mean? It's of no value to me. But it exactly goes to my point. You have, say, one hip, right, that moves like this, right? You can see it sticks up in the air, right, up to here. I don't know, you can see it's right in line with that wording, right? And I have another hip. Woohoo, look at that. Way different, okay, as far as the motion. It's way lower, all right? And so, could hips and pelvises and feet and legs be like sisters and not twins? Abso-freaking-lutely, if you ask me. And this is what the evidence shows. The evidence shows that, like, we are not perfectly symmetrical. There are people who walk around with one leg longer than the other, and guess what? They don't know it until they start to have back pain. And they go to the chiropractor, and it becomes a problem, and it becomes like this mission to correct the leg length discrepancy. It was there since you were born, maybe. Or Charlie has hips. This hip moves like this. This hip moves like this. But I have no pain. But guess what? Thankfully, I know what I know. But if I were to go to someone, right, and I were to show them this, and I would say, oh, my left butt hurts, they'd say, your hip is stiff. Stretch it out. You've got to make it symmetrical. But could it be the hips are just naturally not symmetrical and they've always been like that? Could it be that they're more like sisters and they're not supposed to be twins? And this is really important because we have no normative value and or no gold standard like reference, no baseline for knowing what is normal as it relates to symmetry in the pelvis, leg length discrepancy, one foot being bigger than the other, having less motion on one side than the other side, having bony landmarks that are slightly, out of symmetry, if you will, because the body, by the way, is like not inherently fully symmetrical. But we try to treat it like that. We try to say the right side should be just like the left side. But that's just not true. But as soon as people start to develop pain, then we try to force that narrative on them. And it leads to you spending a lot of money going to the chiro, you spending a lot of money going to PT to try to realign stuff, you spending a lot of money to go to the massage therapist to release this or release that so that this happens or that happens. And it's just a bunch of baloney. It's not based off of anything. A compass does not work if you do not have like some true north, magnetic north, true north, whatever you want to call it. It has no reference to determine whether this is south or this is east or this is whatever. Everything requires some clear, definitive, standard reference criterion baseline. You can't have white without black. You can't have abnormal without establishing what a normal is. And I would argue, not like a baseline normal, like across the board, as far as like everybody as a human who walks, right, has a pelvis that this is the norm and this is not the norm. I'm talking about like a normal for you. What is Cheryl's normal? What is Charlie's normal? What is Heather's normal? What is Cameron's normal? And the only way we know is we start to measure that and we track it. And we track it from, say, 5 years old and on. Because, again, if we don't, then what happens is people that you go to see who are smarter than you or more educated, they're not more educated. Well, they're more educated in the sense of they've gone to school for lots of years. But they're not necessarily smarter. They're just indoctrinated and or brainwashed into a way of thinking. Okay, if you have this, then we think we can feel this, we can feel that. It has no basis. So if you are going somewhere and they're telling you your one leg is longer than the other, so as and your hip flexors are pulling this way and pulling that way, it's 100% theoretical, based off of no evidence and or any standard or baseline. Why? Because you never measured what you were like before pain. And therefore, because we now know, right, hopefully now you know, and because I'm telling you that people are inherently asymmetrical, and this is what the evidence suggests, you cannot base your treatment and your examination off of something where you have no baseline from which to make a statement or a decision or a call. I cannot tell you your pelvis is out of alignment if I have no way of saying this is what a normal pelvis should be. I cannot tell you your right hip is rotated if I have no standard for what a neutral rotation looks like. But if you're in pain and if you ask a chiropractor for their recommendation, 9 times out of 10, they will tell you have some subluxation, or you have one leg that's longer than the other. You have something. Oh my gosh, you're so out of alignment. In order to have out of alignment, you need to have alignment, and you need to have defined that. In order to tell what south is, you need to know what north is, and there needs to be no question, and every compass can agree. Not everybody can agree what alignment is. Therefore, there is no way, and you know what, that we can all agree on what out of alignment is. And this is the problem. This is why you go see a million different people, and they give you a million different answers. And so I'm not here to tell you that there's any norm. I'm just here to teach you a process, because at the end of the day, you're going to know what feels best for your body, and you're going to discover it if you're willing to put in some effort. That's it. Okay? And you can tell I get passionate about this. And that eyebrow thing is just so darn simple, and it makes sense. Eyebrows are like sisters, not twins. Your body, right versus left, one leg versus the other leg, pelvis, this side, that side, front to back. It's within the same system. It's related, right? Sisters. But it is not meant to be this identical twin, and trying to make it like that, just like mother-in-law was trying to get the eyebrows maybe to look symmetrical, right, is bucking the system, is going against probably like just nature, just the way that we're designed. Hopefully this was helpful. I don't think I need to beat a dead horse, but hopefully this was useful for anybody this morning. And the reason this has such implications is because imagine what it would be like to try to heal in a world and or in a place where there is no out of alignment, where you don't have to be worried about trying to correct your leg length anymore. You don't have to be worried about doing all kinds of hip flexor stretches to try to get your anterior rotation corrected. You don't have to do muscle energy techniques where you push-pull or you do this to try to realign things. Your body's not that fragile, and it's not designed to be symmetrical to begin with. And so if you dropped all of those narratives, which in turn, for most people, will lower the level of concern, worry, fear, questioning, confusion, overwhelm. Then you can automatically start to reduce your pain once you realize that it's all made up. Isn't that crazy? You have all these really smart people, right? Or so-called, telling you, your pelvis is this, your pelvis is that. There's zero evidence to support that. And you can boil it down to eyebrows are sisters, not twins. If you have no normative value, and if you were to ask them, what is normal pelvic positioning? And show me what that looks like across the board. And what is normal pelvic positioning for me, since you've known me for so long? How do you know this isn't normal for me? And if you don't have a true north, if you don't have a normal, a baseline, to say this is the way it should be, then how are you able to say that this is what it shouldn't be? It's impossible. It's basic logic. You could defy anybody who you saw who starts saying this or that just by asking that question, just by talking about your eyebrows. All right? Fascinating stuff. Hopefully that is freeing for you. If you've gone somewhere and they told you your pelvis is twisted, you have an outflare, you have an inflare, you have a nutation, a counter nutation, an upslip, a downslip, a leg length this, a leg length that, your pelvis is twisted. Whatever baloney they want to tell you, you can go talk to them about eyebrows. You can go talk to them about, without a north, you don't know what south is, without a baseline, and a validated standard normative value for what this is normally, it is impossible to tell me what it is and how it may be abnormal. Okay? Without white, you don't have black. Without black, you don't have white. Without up, you don't have down. This is called law of polarity. It's just the way it works. It's just the way the world works. All right? And so don't fall for it, okay? Because if you fall for it, then you're going to be in a world of hurt. Because these narratives are not conducive to you healing. They're conducive to you going and trying to fix stuff, which may or may not be the problem. And if it helps, that's great. But don't buy into the narrative about why it's helping per se, if they're giving you that narrative. Yep, see, your pelvis is twisted. I pulled on your leg, and I did this, and I did that, and you did this stretch, and you did that stretch, and now you feel better. See, that was it. No, it could have been anything. You could take a sugar pill and feel better. It could have been placebo. It could have been your belief. It could have been that you love that chiropractor. Could have been that you love their eyes or their eyebrows. That's it. You don't need to make this more complicated than it is. The world will try to tell you that it needs to be complicated. Now, it is complex and that there are a lot of moving parts, all right? But it doesn't need to be complicated. The more complex the problem is, the simpler the solution. This is called Occam's razor. The simplest solution is usually the best solution. Keep it simple. Challenge status quo. And don't buy into the narrative. All right. Hopefully this was helpful. Let me know your thoughts below.